So good afternoon, everyone. After listening to previous speakers regarding adjuvant treatment in post-op lung cancer, we have seen that there is only a modest benefit of almost 5% in 5-year overall survival with adjuvant chemotherapy. And we also know that there is quite risk of recurrence of almost 45% 5-year recurrence risk is there in stage 1B and 76% in stage 3C. And also in ALK positive small cell, non-small cell lung cancer, the risk of recurrence is more in the CNS part. And also the 5-year survival starting from 71% in stage 1B to only 36% in stage 3A. So is there any role of targeted therapy, because we are having a changing landscape in adjuvant therapy from chemotherapy to targeted therapy and perioperative immunotherapy. So can we give targeted adjuvant therapy in ALK positive lung cancer? So the data is coming from this ALINA trial in which the alectinib role was seen. So it was a randomized open label phase 3 trial in which stage 1B, 2 and 3A patients were randomized to alectinib 600 mg BD for 2 years and was directly compared with platinum based chemotherapy. Either pemetrexed or vinorelbine or gemcitabine were used for 4 cycles and alectinib for 2 years. So primary endpoint of this trial was disease-free survival rate, and secondary endpoint was CNS disease-free survival rate, overall survival and safety point of view. So in ALINA trial, when we see the baseline characteristics, so it was quite matched with alectinib and chemotherapy arm. So coming directly to the primary analysis, so it is very important when we see the primary endpoint of disease-free survival rate in stage 1B to stage 3A in intention to treat population. So it is very clear that there was a significant improvement in DFS. It was almost 30% absolute benefit was seen at 3 years DFS rate from 54% to 88% in alectinib arm with a hazard ratio of 0.24. So when we go deeper inside it, so there was a quite dip in the disease-free survival rate when you see after 2 years completion of alectinib. So whether a prolonged duration of alectinib will help in the adjuvant course, we don't know, because in ADAURA trial, 3 years of osimertinib was used, and in this trial, only 2 years of alectinib was used. So apart from disease-free survival rate, CNS DFS benefit was also seen, which was seen in the exploratory analysis, and almost 15% absolute benefit was seen with alectinib arm. So it is quite clear that adjuvant alectinib, when compared with adjuvant chemotherapy, there was significant disease-free survival rate, which is a quite good the survival endpoint in case of adjuvant treatment therapy. So as CNS DFS is very important, because when we see the sites of recurrence, brain was the commonest recurrent site in chemotherapy arm in ALK positive NSCLC. So that's why CNS DFS is very important. So regarding subsequent treatment in a post-progression setting, almost you can see that 76% of the chemotherapy patients received subsequent ALK inhibitor, either alectinib, brigatinib, crizotinib, lorlatinib or ceritinib. So this is very important. We will discuss it later. Coming to safety point of view, safety analysis, median treatment duration of alectinib was 23.9 months versus chemotherapy, it was 2.1 months only, and alectinib was quite tolerable and manageable safety profile was there, and the safety, these things, adverse events were almost known to the profile of alectinib, like raised in CPK or constipation or transaminitis was quite common in alectinib, while nausea, vomiting, anorexia was quite common in chemotherapy. And because of all those adverse events, the dose reduction and interruption was more common in alectinib arm, while treatment withdrawal was more common in chemotherapy arm. So as we are giving 2 years alectinib in adjuvant setting, whether this 2 years of alectinib will hamper the quality of life of the patient. So in 2024 ASCO meeting, the health related quality of life data has been presented as an exploratory analysis of ALINA trial. And they found that use of alectinib, there was a gradual improvement in the quality of life. You can see up to week 12, and gradually it was further improving and matching the general population at the end of week 96. While in the chemotherapy arm, the quality of life was getting poorer at week 12, that is the end of chemotherapy, and after completion of chemotherapy, there was improvement in quality of life. So at the end of 2 years, there was gradual improvement in quality of life with alectinib. So they concluded that, so already there was benefit of DFS was seen in ALINA trial, and it was present in ESMO 2023. In 2024, they have seen that the quality of life is quite maintained at the end of 2 years. So they concluded that there is a good good data of adjuvant alectinib, and it can be tried in ALK-positive NSCLC patients. So my take-off message is that we have seen that there is improvement in efficacy. There was improvement in DFS. There was improvement in CNS DFS with alectinib. Adjuvant alectinib was quite tolerable, and there was no unexpected adverse events, and quality of life was also maintained. But there are few questions which should be need to be answered. Maybe in further trials we will get some the data regarding all these things, that whether addition of chemotherapy with ALK inhibitor will help or not, whether sequential therapy with 4 cycles of chemotherapy followed by ALK inhibitor, especially in stage 2 or stage 3, will help or not. Is 2-year duration of alectinib is okay, because we have seen the dip in DFS after stopping alectinib, as in ADAURA trial 3 years of this osimertinib have shown quite benefit. So again, duration is also important. So can we use, or maybe in the further time we will get data regarding further other potent TKI like lorlatinib can be used or not, because lorlatinib have the better efficacy, but it is having a poor tolerance rate. Cost is again an issue, because 2 years of alectinib, again, it is a costly drug. And at the time of data cutoff, the OS data was immature, because only 6 dates were seen. And also important is that 76% of patients in the chemotherapy arm took post-progression this TKI. So whether this post-progression TKI will change the this OS data, or this this improvement in DFS will translate into the improvement in overall survival or not, let's see. And long-term follow-up will tell all these things. So right now, alectinib has been approved by FDA in adjuvant therapy setting of stage 1A to stage 3, sorry, stage 1B to stage 3A, and also have a category 1 NCCN recommendation. So adjuvant alectinib should be preferred over chemotherapy if possible in ALK-positive lung cancer. Thank you so much.